Motherhood can be exciting, it can be a blessing, it can even be a dream come true. But for 1 in 7 new mothers, it can be something entirely different.
I did not want that pregnancy at all. If I believed in abortion, I'd have probably aborted him.
I just feel like me don't want to keep the pregnancy. Because I'm just not happy with it. I wasn't ready. I didn't plan for it.
I did everything I could to see my period. Things that they say pregnant people are not supposed to do, I made it my point of duty to do because I wanted to see blood.
This feeling of not wanting a child, not loving your child, not having a bond with your own child, having thoughts of harming yourself or your child is linked to a mental illness called postpartum depression. But what is postpartum depression?
Postpartum depression, it can be suffered by both mother and father based on what I know about it, but mostly mothers, and it's the depression specifically connected to a mother who has just given birth. And so sometimes she feels like she doesn't want the child, or she feels depressed in herself for varying reasons. I don't know, and I'm not that really deep into it, but that's what I know about PPD.
Postpartum. I don't know what is postpartum depression.
It's the same thing they call baby blues. I know this because I have a child. So it's a mood disorder when you're irritable, when you have like extreme sadness, things like that.
People just feel sad they have to deal with stress and some bag of stress and worry about the wrong things and then something in their life, you see me?
Postpartum depression. I think it has to do with something after pregnancy.
I don't know exactly what I mean, but it's something like after pregnancy, when people feel like probably they can't take care of the baby because, or they don't understand the baby because they new to the world and they might go through different changes and something with them. Because they can't talk, so the mother can't really understand everything, so they kind of feel one way. I don't know, kind of depressed.
Well, based on what I remember, I think it's a depression that you feel after you give birth, where you just feel this overwhelming sadness after giving birth to a child.
Postpartum depression is basically, from my understanding, a mood disorder that affects women after they've given birth.
Postpartum depression is a mental state of the mother that deteriorates somewhat during the postpartum period. That's from birth to 6 weeks after. It's called the postpartum phase. All right, so in this point, it's when the mother goes through feelings or thoughts of inability to cope, care for the child and herself, and may even at times, if it gets severe, develop sense of suicide and may even hurt the child.
Based on interviews done with 9 mothers between the ages of 18 and 35 in Western Jamaica, they were either affected by the symptoms of postpartum depression or failed to seek assistance. Midwives who constantly saw patients outlined that the illness was prevalent in Western Jamaica.
Not everybody would have recognized the signs or come to an admission that they are going through some phase of depression.
Some of the causes of postpartum depression are unplanned pregnancy, physical changes in the mother's body, lack of family support, financial difficulties, a difficult labor, and a history of mental health problems within the mother's family.
I experienced depression in my first pregnancy. I think probably about the 2nd month after I got pregnant with my 2nd pregnancy, I was depressed up until probably my 3rd pregnancy, and I was still depressed.
The experience of this mother with postpartum depression was very painful, and she is not alone.
For my 2nd pregnancy, I experienced it throughout all the trimesters, the 1st, 2nd, and 3rd trimesters. And for the first pregnancy, I only experienced that in the first 3 months, the first trimester.
The recurrence of postpartum depression was an issue which midwives saw as being dangerous for mothers, as the severity can increase.
It's always possible. Again, with each pregnancy, it can cause the condition to return and get worse. Wherein it may not have occurred with the first pregnancy, it is there with the second pregnancy, and it might come severe with the second pregnancy because of mommy's mental state and financial state and the fact that there's no family support around her now.
These conditions are a few of the factors that can lead mothers into a state of postpartum depression.
With my first pregnancy, I was in a relationship for over 2 years. When I found out I was pregnant, told the guy, he basically disappeared. And I was living alone at the time. In my second pregnancy, the apprehension mostly was because this is 5 years, I had only one child, and I gave her everything. So I was like, I'm pregnant again. No, what am I going to do? Am I going to love this child the way how I love my first child?
Another mother shared similar sentiments.
During my first pregnancy, I was feeling pressured because my mother wasn't there for me, and I was like, where am I going to get baby clothes, and how am I going to take care of a child without my mother's help, and so forth.
Feelings of anxiety and loneliness are just a few of the symptoms our mother experienced during her first pregnancy.
I didn't know what was going to happen. Loneliness, because I lived alone. I didn't have any. I'm from Kingston, really. Most of my friends are in Kingston who would be there to support me. My mother wasn't here. How am I going to then extend myself to another child? So that was where the whole depression and the crying, I don't know why, but yeah, that was it. And after she was born, I was kind of detached from her in some sense. I can't explain it, but it was like the attachment that I felt with my first child, it wasn't there.
The feelings of withdrawal felt by this mother was something midwife Hilton sensed as being life-threatening.
Apart from the withdrawal and the not wanting to care for themselves, they may have the suicidal thoughts. So withdrawal and the suicidal and not wanting to care for the child. Going untreated could be suicidal.
As her mother moved into her third pregnancy, her feelings of withdrawal became more intense, and her life as well as that of her child were now at risk.
My third pregnancy, okay. The relationship, in my opinion, the relationship wasn't as strong as before, and I was thinking mostly of actually exiting the relationship when I found out I was pregnant. So, I normally say that if I believed in abortion, I'd have probably aborted him. I did not want that pregnancy at all. To show you how detached I was from that pregnancy, I did not see a doctor until I was about 6 months pregnant. Wow. I did everything I could to see my period. Things that they say pregnant people are not supposed to do, I made it my point of duty to do because I wanted to see blood. I did not buy anything for this child until I was 8 months pregnant. My first pregnancy, by the time I was 6 months pregnant, my bag was packed. When I was pregnant with my second child, by the time I was about 7 months pregnant, my bag was packed. At 8 months, I had nothing for this child. And I was there, and I think it was when I was about to enter into my 9th month. When my 9th month, and I realized that, I guess I guess I'm just going to have to. I guess this child is going to be boring, and I guess I need to get things for him. So, but the thing about it now is that he was boring, and I love him. Oh Lord, I love him so.
The strong impact of postpartum depression led this mother wanting to commit.
Suicide. I thought about ending, just taking some pills and just end all of this I was going through. Because, as I said, I was in turmoil. I know I felt like I don't know. I just wanted to end what, because as I said, tears. I was always crying, and I just wanted to end everything. So.
The symptoms of postpartum depression are indeed serious and greatly affected this mother. Other mothers interviewed experienced symptoms that this mother did not encounter. These include
anger, depression, neglect,
sadness, anger, doubt, fright, all of that. Just all of that.
all these symptoms create emotional stress in mothers, and this in turn often directly affects their children.
My first child, she's very sensitive, and when I'm going through whatever emotional stresses, I don't know how she pick it up, but she pick it up.
Besides having to cope with their mother's seeming neglect, children may have to endure having to contend with a hostile mother, as was the case for this particular mother.
I feel anger even for my son. Even sometimes come near me, like me they push him away, but then at times I realize what me they do.
Midwives believe that postpartum depression can seriously affect the mother-child relationship. The child may feel a lack of care and compassion, and as for the relationship with the wider family, this may also become strained.
I think it affects everybody that is involved. The father, even though he may or may not have to go out to work, him coming in having to look after the baby, that's also another stress on him, and that can cause other conflicts within the family. Grandparents are also affected because now grandparents have to take over the role of parents and also be looking after the mother herself. So that's an additional strain, wherein mommy could go around and help with a few chores or look after the baby. That's no longer the case. So the burden financially, physically, and again psychologically and the entire family is present.
Even though postpartum depression affects both mothers and children, the cases are not hopeless, as treatments are available.
Counseling. Counseling is the first. We don't tend to jump to hardcore drugs unless it is absolutely necessary. The benefit has to outweigh the risk.
Counseling is always preferred, with doctors only administering drugs as a last resort. Besides medication and counseling, mothers can find relief through exercise.
For the depression, I exercise because I play netball right through. So that kind of gives my mind a ease of the depressions and the things that I'm going through at times.
Although medication, counseling, and exercise are great treatment options, support from family and friends is seen by medical professionals as one of the best remedies for treating postpartum depression. One mother attests to this fact.
Talking to my mother and to my friends too, because even though they're not physically here with me, and oh my God, I have some nice co-workers, because with my very last pregnancy, that was a toll. I tell you, I'm going through emotional stressor, going through my whatever stresses with my partner. I'll be going to work and things happening, and I just sit down and want somebody will come and just give me a rub, you know, just have that person that you can really confide in. And I tell you, my co-workers, they were there for me. They were there for me, and when my mother came, my mother has been there for me as well. So you have to have a good support system.
The local health centers, though equipped to assist mothers with postpartum depression, are not without their challenges. One mother has this to say.
The doctors judged, they had things to say, not necessarily good things, and it wasn't a good time in my life. if doctors judge you, what would outsiders do? What would my friends do? What would persons around my age say or do?
For Santina Brown, her promise of having multiple counseling sessions were made void after the first session.
When I first went to the health center, that was in July 2014, I was asked and I was told that I would be placed on a counseling on a regular basis. So I would see a counselor probably once per month. But the first counseling session was in Savannah Lamar. I didn't have a second one.
To help address these challenges, both the mothers and nurses alike had these recommendations for the health sector.
The first thing I would want them to do is be more welcoming to them, find out where their head is at before telling them what's out there or whatever, you know. Speak to them, know the child, because if someone had came to me and said, how are you? Even how are you? I feel like I would have opened up more.
Sometimes you see a person comes to the clinic and they look smiling, beautiful, but you don't know what they're going through. Just to ask them questions, because probably then when you ask, if they decide to be honest, then they will tell you what they're going through, because they wouldn't know what I'm going through because they didn't ask. They just ask about the pregnancy, but they don't ask about me.
I would say that more can be done as it relates to capturing the cases. Why I say that? Sometimes being the interviewer to a postpartum or postnatal patient, don't just sweep things under the rug. They say, oh, I'm fine. Don't just take that. Probe. You know, we have this kind of interactive method in interviewing, one that I cannot speak about, but we know how to get the information out in a nice, calm and tactful manner. I do believe that we can enhance that each one can help another.
Postpartum depression, mental illness on a whole, is no respecter of persons. It can happen to anybody, and it happens to the very educated, it happens to the uneducated.
We are all susceptible, and just like any other illness, this is an illness that can be prevented and also treated in the same case. So we need to protect our mental health as much as our physical health.
Although the challenges of living with postpartum depression are many and oftentimes burdensome, this mother would like to encourage all mothers that they should
never give up. That's just it. Never give up. No matter what people say, no matter what your mind tells you, never give up.
Perhaps you or someone you know have been affected by postpartum depression. However, you're not alone. There are a wide range of treatment options and support available. Mothers, effectively managing postpartum depression first begins with you. Contact your local health clinic where you can find the support and assistance needed to get on with your life. Together, we can fight postpartum depression and save our families one mom at a time.